is that we got all these networks in our brain. And where most of the action happens when you take illicit drugs or street drugs, or even take prescription drugs, happens right in this little area. That's called the synapse. We're going to go into a great deal of that today. So we're going to explain how your body works and how they work with all these receptor sites and things. And I know there's going to be some big words in here. Just try to get the overview of the actual picture, okay? Now, we call it brain-based addiction recovery. As I said, treatment should be in conjunction with other programs that are available out there. And obviously, we have put a disclaimer in. These statements have been evaluated by the FDA. They're for educational purposes, not intended to diagnose, treat, cure any disease. Okay? Now, there's all kinds of definitions out there for addiction. Okay, so some of the short definitions is that it's a chronic disease of brain reward, motivation, and memory of the related circuitry. Because your brain is nothing but a circuit. It's like a bunch of wiring that comes together in your house, and it has to work. And you get dysfunction in these circuits, and it leads to biological, psychological, social, and spiritual manifestations. Okay? So obviously, the individual pathology, they want to preserve, they want to pursue this reward system when they use drugs. Now, it's characterized by, obviously, the inability to consistently abstain. Now, way back in the day, we talked about drug addiction, and they say, that patient doesn't have enough willpower. We're going to find out today that willpower doesn't play a huge role in it, okay? Obviously, it does help to some degree, but it's not how the body actually works, okay? They have significant problems with their families, interpersonal relationships, and obviously, they have emotional responses. Now, this is a long definition of addiction, and basically, this is where we come in, because what it does is it says addiction affects the neurotransmission and interactions within the reward structures of the brain. And there's a nucleus in your brain called the nucleus accumbens. You don't need to know these big words, but that's the huge one that drugs work on, okay? When they put you maybe on Suboxone or Methadone or things like that, they try to stimulate that area. And what happens is that it can affect the areas between your brain and your hippocampus. Now, the hippocampus in your brain, that's your memory center. That's where your short-term memory goes to long-term memory, and that can actually start to break down. Now, in general, all drugs affect dopamine. That's a big one. We're going to talk about dopamine, okay? Because what does dopamine do? That's our pleasure and reward system. And dopamine, you get the reward, positive reinforcement. And one common feature in all the drugs is that it affects this mesocortical limbic area. And I know that's a big word, but all that means is your midbrain, and the cortical is this part of your brain here. And it is a system. It's a pathway, and we'll be talking about those pathways. Here's the mesolimbic system. Okay, so right here is where you make the substantia nigra. That's where you make dopamine. Okay, and dopamine then fires up into the frontal region. So it's made in your midbrain. That's the meso part, and cortical goes through your frontal cortex. So there's a pathway there. Now we also have our mesolimbic system. The mesolimbic system is it fires here and it fires into this area here, and this little area in this here in your brain. That's your limbic system. So it controls what? Our emotions. Okay, and these is where drugs react. Okay. Now, some people say that compulsive drug use and cravings persist and recur even after extended periods of absence. Why is that? Because you can take somebody who was an alcoholic and then what? 10, 15 years later they've been going to AA and they're doing great and they haven't had a drink, but they still crave alcohol because no one fixed the underlying deficiencies that cause the cravings, okay? And these are nutrients that we need in our body. You're going to find out today that these nutrients create each biochemical step. And if you don't have these nutrients, those biochemical steps do not work. Now, learning, memory, attention, and look at this one, impulse control. That's why they keep going back, because they have loss of inhibition. What part of your brain controls that? Your frontal lobes. So when these frontal lobes aren't firing, you have no inhibition. So you just keep using and using, even though you know that it's not going to be good the next day, or the 2 days after, or the 3 days. It deregulates the brain reward system, and when you increase dopamine, whether it's through drugs or any other means, it produces pleasurable feelings, and the drug abuse hyperactivates the system. That's why they want to keep going back to it, because you produce more and more dopamine. One of the big things is it promotes the formation of maladaptive drug stimulus associations. So there are different definitions. This is kind of, in a nutshell, what it is. It dysregulates the midbrain, loss of control, cravings, compulsive drug-seeking behavior. Even though they know the consequences are going to be negative, they might have a hearing at the courthouse tomorrow, and what do? They go out and use, even though they know they have to go to court, even though it might be a family reunion or a wedding or something, they go out and use, and despite the negative consequences, they still do it. and we'll talk why that is. Okay? Now, existing treatment out there, which we're all for, we're not against it. Obviously, they put them in detox for about, however long it is, and obviously it's under medical supervision to control the withdrawal because you're going to get a lot of side effects, and they're going to get a lot of physiological symptoms like sweating, increased heart rate, things like that. Alcohol, they might use Antabuse, naltrexone, Vivitrol, opioids, Suboxone, Subutex, Methadone, naltrexone, and Vivitrol. Now, also, once they get out of that, they might go to an inpatient rehab for 30, 60, or 90 days, and then they might go to an intensive outpatient program or a 12-step program, okay? Now, the problem with drug addiction is that nobody has a definition what drug success is. So some places you call them up and say, okay, what's your success rate? And they say 85%. I say, how do you determine that? Well, if they stay in our program for 90 days, that's success. So I said, if they go out on day 91 and use drugs, that's still considered a success? Yes, it is. And just like some cancer studies, they only do them for 5 years. So if you have cancer and you live longer than 5 years, if you die 5 years in one day, they say they fixed your cancer. So it can skew the numbers. So there really is no definition. I think what they need to do is come up with a definition. Our definition is when they're no longer using, and then they're back in society and they're being productive in society, and they're staying drug-free. Some other places are, well, if you don't get arrested for 2 months after you get out of rehab, that's considered to be successful. Now, medical, what they have in their toolbox is they allow the midbrain to rest, trying to strengthen the frontal cortex. Well, let me tell you, there's a lot better ways to strengthen that frontal cortex. And we're going to show you that, and Dr. Hardy's going to explain some of that today. Okay? They allow the behavioral, emotional, mental components to develop the frontal lobe. And they practice in a less than stressful environment, right? That's why they put you in the rehab for 30 to 60 to 90 days. Okay? But it is a disease of the brain. It dysregulates pleasure and reward, loss of control, cravings, and persistent drug use. It is a family disease because it affects everyone in the family, and other relatives for that matter. And sometimes it can be genetic. So just because you have a genetic predisposition, it doesn't mean that you can't fix the problem. Now, what do? We do a functional medicine approach. So what we do is we see what deprived you. If you're a drug addict and you use drugs for a while or alcohol for a while, obviously it had to affect the system. So what do? We look at all the chemistry, okay? And you're going to find out that some of these things are made in your stomach. Hormonal things can affect your dopamine levels. Okay, like estrogen. So if you have too much estrogen, that could be a problem. If you have too less of estrogen, that could be a problem. And the adrenal glands are stress glands. Obviously, drug addicts are underneath a lot of stress. And when your adrenal glands become fatigued, it can actually affect the way your body metabolizes sugar and the way your body uses insulin. And you're going to see that that's very important because if you don't have enough insulin, you can't transport dopamine and serotonin into the brain, or either GABA, because that goes through the citric acid cycle, okay? So you can't transport those things. And that's why when they quit taking, they feel what? They feel way down, they don't have no motivation, sometimes they have no appetite, and it makes it worse. Now, it's not uncommon for someone doing functional medicine to look at the gut to see if their gut health is affecting the brain. Okay, in med school I wrote a paper and I showed how inflammation in the gut affects the brain. It can lead to Alzheimer's, dementia, and multiple sclerosis. And a lot of people won't have symptoms in their gut. If you have no symptoms, your doctor's not going to check your gut out. So that's what happens. Okay? How does the brain communicate? Well, Dr. Hardy's going to go in more detail with this, but here's the deal. You have an action potential. So there's a stimulus here and it sends down. And right in this area here, the synapse, that's where I showed you before where all the fireworks take place. So we're going to focus on that area because that's where illegal street drugs work, and that's where the drugs that they put you on when you're going through rehab work. And then it sends it simply here, it sends it up to another part of your brain or to another area of your body. Now, we have to have fuel for our brain. So we have dopamine, we have serotonin, we have GABA, norepinephrine, epinephrine, we got endorphins and enkephalins and dynorphins. And it's just like you need gas to ignite the spark plug on your lawnmower, right? Well, you need these neurotransmitters to spark to get your brain to fire properly. And when you don't have the right kind of gas, or the gas is, you don't have enough of it, it's not going to work properly. Functions of dopamine, these are important. Attention, cognition, emotions, learning, mood, motivation, and motor conduction. Okay? So dopamine does that. So what I'm going to do is I'm going to draw out on the board how we actually make dopamine in our body. Okay? So let's turn this around so everyone can see a little bit. So here's the deal. How do we make dopamine? Why is that important? Because when you take drugs, your dopamine levels go down. So we've got to understand how your body produces dopamine so that when you're trying to get off drugs, we want to try to what? Increase the dopamine levels in your brain so you feel better and your motivation is better, okay? So first of all, with dopamine, we have something called phenylalanine. I'm not going to write these all out. And we have something called tyrosine. These are amino acids, and we get them in our food. So when we eat food, protein and things break down into amino acids, and some of the foods need phenylalanine or tyrosine. Now, phenylalanine has to be converted in the liver, and it's something called phenylalanine hydroxylase, and that happens in the liver. And then that converts into tyrosine. So if you eat food that has tyrosine in it, you'll make your own tyrosine. Now what we have to do is you have to realize dopamine, serotonin, and GABA, all these things cannot cross the blood-brain barrier. We got a mesh around our neck, and it's a very small mesh. Has anybody ever seen a big spaghetti colander with big holes in it? Okay, that's a big mesh, right? A lot of things could, if you tried to put something smaller in there, go right through the hole. Now you take that little gravy mesh, it's real small holes, okay? That's what we have around our brain. It's like a net, and it only allows certain size molecules in so these other molecules don't get up there and damage your brain. And so this tyrosine has to be transported up into the brain, and we're going to call this our blood-brain barrier, okay? Now, we have a little bus here. We call this the NLAA bus because this is what transports tyrosine. And what happens is you have these other amino acids in our body, and they have to be in a certain ratio. And what happens is that in order for tyrosine to get on the bus, these three have to get off. So who's the boss? It tells them, hey, come and get off the bus. Well, guess what it is? It's insulin. And when you eat food, you increase your insulin. And when you increase insulin, it tells these things, hey, get off the bus, go to the tissues. Guess what? Then tyrosine gets on, and then the bus starts to motor and go up into the blood-brain barrier. Now it has to go through a tunnel here, okay? And only certain molecules can get through there. So dopamine and serotonin or GABA can't get through the blood-brain barrier. That's why they can't give you a shot of dopamine or a shot of serotonin or GABA. If it was that easy, it would be easy. So when it's depressed, we might give them dopamine or shoot them up with serotonin. And when it gets up in the brain, then tyrosine, what happens is tyrosine has to be converted into dopamine, and it's a two-step process. First it goes into L-dopa, and then it goes into dopa. But you have to remember, this is dopamine. And you have to remember that each one of these steps is a biochemical step, and they need a cofactor for that to do it. So what happens is there's an enzyme called tyrosine hydroxylase that helps convert it. But in order for that to convert into L-dopa, you're going to need iron, you're going to need oxygen, and you're going to need something called tetrahydrobiopterin, which comes from folic acid. Guess where that's made? In your gut. So if you don't have a healthy gut, you can't produce tetrahydrobiopterin. Okay? Now, if you have all three of these, it goes and makes L-dopa. Now to take L-dopa and make it into dopamine, you need something called AAD. I'm not going to get into big names. And the other thing you need is B6. And if you don't have enough B6, you will not make dopamine. So this is how your body makes dopamine. So has any drug rehabilitation center ever checked anybody for B6 anemia and things like that? Probably not. Because that's not the way that they were trained to do it. Now I'm all for what they're doing, but we have to put more spokes in the wheel to get the patients back to where they were prior to becoming an addict. So let's talk about what decreases dopamine. Okay? So, I said this first step takes place in the liver. Did you ever hear of a drug addict having hepatitis C? Of course. And if they have hep C, this step might not work. Now, they have to get on the bus, and that requires insulin. So if they have dysglycemia, if they have high blood sugar, low blood sugar, diabetes, that's going to affect the insulin levels. And then the bus doesn't move to take it up into the brain. And then once you get up into the brain, if they have iron deficiency or they got iron deficiency or iron anemia, okay? Or you might have B12 anemia or whatever. If you have anemia, this step doesn't work. If you have an unhealthy gut, if you have what we call, if you got dysbiosis in your gut, dysbiosis, you got good and bad bacteria in your gut. And when you have a dysbiotic gut, that means the good and bad bacteria is not in the right proportions. And if it's not in the right proportions, you can't make folic acid, which then goes and makes tetrahydrobiopterin, THB. So if you don't have a healthy gut, you might not make that. You can't make L-dopa. Now, B6. If you don't have enough B6, what can decrease our B6? Well, number one, alcohol can. Okay? So if you've been drinking alcohol for a while, you're going to decrease B6 and you're going to make dopamine. So how do alcoholics feel when they're coming down? a little depressed, not motivated, just keep doing things they're doing, right? And what else can cause that? If you're on chronic SSRIs, these are serotonin reuptake inhibitors, selective serotonin reuptake inhibitors. And if you're on them for chronic periods of time, you can decrease your B6. So you might be taking that pill, and I'll show you how these drugs work. You can take that pill, and you can see this, that if they take it for long terms, they might be sparing their serotonin, but they're starting to deplete their dopamine, okay? So that's how your body makes dopamine, and here's the other thing your dopamine has to do. Once you make dopamine, then you have to break it down. Because in that little synapse where all the fireworks are going off, if you get too much dopamine, what happens is you got receptor sites in there, like a key and lock mechanism. And when those receptor sites start to shut down, or when you get too much, they quit growing receptor sites and you don't get as many, what happens? The person could have the right amount of dopamine, but they can't send the signals up into the brain. Okay? So dopamine just breaks down into something called HPA. I'm not going to give you the big long name, it doesn't matter. But there's certain things that you need, and one of them is called catechol-methyltransferase. And guess what? If you have hypothyroidism, if you're on anti-acid medication, or if you have reflux, if you're on estrogen or birth control or hormonal replacement, that can prevent you from breaking down dopamine. And what's going to happen? You're going to get too much into that little area, and what's going to happen? Receptor site shut down, you can't get the message in, and you don't feel very well. Okay? And then we'll talk about foods, okay? Let's talk a little bit about foods. So, if you're a drug addict and we're trying to increase your dopamine levels, what should we do? Wouldn't it be smart or common sense to take foods, eat foods that increase your dopamine levels in your body? So what are some foods that can increase the tyrosine and phenylalanine? Well, wild game can, so if you're a hunter and you like venison, that's good for you, okay? You also got beef. You got chicken, you got turkey, you got cheese, you got eggs, you got oats. So, wouldn't it be better for somebody to eat a ham, or not a ham, but a cheese and egg omelet in the morning versus what? Cheerios, Raisin Bran? If they eat eggs, they're going to produce more dopamine. So what our long-term goal is have an inpatient center where we can give these patients the right foods that they need when they're in there. Because I can guarantee you, I haven't seen that done anywhere, because no one's looking at what caused the cravings and what causes their brain not to fire the way it usually did. Okay? So once we make this dopamine, then it has to go through the pathways. Now the mesolimbic, that's the one that provokes emotional responses such as pleasure and reward. And then the mesocortical, that helps control our motor activity. So again, if we go back to this, we can see we want to fire these pathways off. Okay? To get the brain to start firing again. And get your frontal. What's your frontal lobe responsible for? Executive function, organization, planning, focus and attention, and what? It controls impulsivity. And that's a major thing that we see when somebody has been an addict. Okay? So remember, right here is where all the fireworks occur. This is a network of things. We have so many of these in our brain, it's just a network, and we got to fire these things off. And remember, the neurotransmitters are the fuel. So what happens is when you make dopamine, it gets in these little vesicles, they go down, and this is where all the fireworks are, right in this area here. And when dopamine gets in this is like a little lake area, it's kind of warded off, and then they go down here and they hit these receptors. Now there's about 5 different dopamine receptors, and what they do is when they hit that, they send dopamine, and dopamine goes to your brain, and you feel what? You feel good. So when someone takes a hit of cocaine or snorts some cocaine, what happens? They flood this with dopamine. And the pleasure and reward becomes what? Much greater. Becomes much greater. So what drugs do is they block. Some of the stuff gets reuptake. And that's why some of the drugs are called reuptake inhibitors. So what do? They block that receptor site so you can't get the drugs to recycle. And it keeps them in this area. And then remember, when you come down here, this is where that COMT works to break down that, because if you get too much dopamine in there, it has to down-regulate the receptor sites. And then guess what? You can have all the dopamine in the world. Those receptor sites shut down, you can't get the message in the cell, and you're not going to feel any difference. So when you have symptoms of low dopamine, feeling of hopelessness, destructive thoughts, worthlessness, you isolate yourself from others, right? Anger and aggression, not rejuvenated after sleep, you can't handle the stress, right? That's a big deal. Unexplained concern for the family, We see that all the time, inability to finish tasks, lose temper for minor reasons. You just say to somebody, hey, you should maybe try this, and what do? They blow up in your face, right? For no reason at all. It's like, I just told you maybe you should try it. That's because they have low dopamine. And the big one is they consume caffeine to get alert, because caffeine is a stimulant for that. Okay? Here's some other ones. Here's the big one. These are the actual conditions: chemical addictions, depressions, anhedonia. That's the inability to experience pleasure. How many drug addicts, when they're coming off a drug, do you think are being pleasurable? Very few.
Not too many.
Okay, very, very few, because they don't have enough dopamine. Social anxiety, learning disorders, ADD, and Parkinson's disease, all due to low dopamine levels in the brain. Now, if you have too much dopamine, then you're going to be psychotic, you're going to do schizophrenia, increased libido, and hypersocial activity. You ever go somewhere and someone's talking, and you're like, wow, I couldn't shut this person up. They had way too much dopamine, okay? I know how that is sometimes. Now, a lot of times they think it was psychological, but what we're seeing is that when you disrupt this neuroendocrine and these neurotransmitters, it's more of a physical than a psychological addiction. Because back in the day we thought it was psychological. That's no longer the case, according to research. Now, they've done imaging studies and show that drug abuse in humans, what it does is that basically when they use these drugs, they give a big dose of dopamine, large and fast. And what do they feel like? They feel great. And as the drug wears off, what do they feel like? They feel like crap, right? They don't feel as well. And look at decreased dopamine function in addicted subject disrupts frontal inhibition. So they have loss of inhibition. So how's your doctor going to fire off your frontal lobe to make it work stronger? Because we know something's called neuroplasticity, that when your brain, if the wiring's there, we can do an exercise on your brain to fire up into that frontal lobe, and we know that that pathway will become stronger. It's called neuroplasticity. Okay? Now, a lot of people may know about it. It's been around for a while, but a lot of neurologists don't know how to do it because they are trained to look for pathology and lesions. Anybody been to a neurologist for rehab? No, why? Because neurologists don't do rehab. Why not? Because they don't do it. They send you to a PT. Does a PT have the training of the brain? Not like we do, okay? We did postgraduate studies in functional neurology, okay? Dr. Hardy's a functional neurologist. I have all the hours, I just haven't taken my test. Besides going to school, running 2 clinics, doing lectures on the weekend, writing 2 books, I don't have enough time to take that test. And I don't really care if I get that degree, because as long as I have it up here, I don't really need it on a piece of paper, okay? So we have to find out how we can help that. Now, these drugs, they say dopamine reuptake inhibitors. So Reuptake and Abilify, how do they work at that receptor site level? Just like I said a little bit earlier, those drugs are going to block this. Okay, it's a reuptake inhibitor. This is supposed to be recycled so you can make more, and you do that. So what it does, it blocks this and it keeps more dopamine or serotonin in the synaptic cleft, and you feel better. And some of them might be a norepinephrine reuptake inhibitor, some of them can be a serotonin reuptake inhibitor. Everyone's a little bit different. These are the drugs that affect those receptors: cocaine, methadone, Ritalin, and Adderall. You see these young kids taking Ritalin and Adderall. Do you know that works on the same receptor as cocaine? What do you think their odds are of becoming a cocaine addict later on down the road? They are definitely increased, and some research shows that it may be as high as 50%. Now, why do they give a child who is all what? Ramped up. Okay, you got this kid running around, you can't control him, and they're going to give him a stimulant. Why do they give him a stimulant? Because when they give him a stimulant, it fires off the frontal lobe. And what's the frontal lobe do? Calms them down. But what it also does is it affects the way they feel and the way they think. I deal with these kids all the time. They come in, they're under Ritalin or Adderall, and they come in, and you talk to them, and it's like it bounces off the back of their brain, then it comes to them, and then they can respond. They're not functioning the way they should be because those drugs do affect the frontal lobe, and that's their whole function. So there's the ones that affect that. Now, so what you do is that when you take drugs, say you take meth, it's going to increase your dopamine levels. So you're going to feel good. And so what happens is that pathway in your brain becomes the highway now. It used to be a country road. Yeah, I did cocaine once in college. I don't do it anymore. That wasn't the highway. But as you keep doing cocaine or your drug of choice or alcohol, what's going to happen? It's going to make that the highway. And when that gets more ingrained, that pathway gets more ingrained, guess what? You're going to have the cravings, and you'll do anything to go get that drug. And you might just be driving up the street, and what happens? Your car just takes a left turn into the bar. You're like, I don't know what happened. Right? What happened is the frontal lobes weren't firing, and they had loss of impulsivity, and they couldn't control themselves. Now, here's what cocaine does. It does the same thing as the dopamine uptake inhibitor. It blocks that reuptake where you get the what? The recycling. So that's where cocaine works on the receptor level. And it blocks that. So what do they feel? They feel pretty good because they got all this dopamine rush, right? And Doc will go into some of the physical changes that you actually see. Now this is a video here. See if it comes up. This kind of explains how drugs work. It explains it better than me. I'll put it to you that way. And it looks like it's going to come up here. Nope. Okay. So no big deal. We'll skip it. But all that video showed was how when you take a drug, let me go back to the receptor site one. When you take a drug, what happens? Sorry about that. All right. So when you take a drug, what's going to happen at that synaptic level? What's going to happen is that it blocks the receptor sites. And so, when you take a drug, it goes here and pings it off. Now, if they give you methadone or some of the other drugs, they go there and they can block these receptors. And so, if you're on methadone and you're taking heroin, it's not going to send as much dopamine in. So the drugs do what? They still fire off some dopamine so you feel better, but they don't give you the euphoric high that you're having when you took the drug itself. But sometimes they put people on methadone or Suboxone, and I've known some people that have been on Suboxone for 10 years. How is that fixing the problem? It's really not, in my opinion. Is it necessary? Yes. During the acute phase of detox, and they have to go through detox, absolutely. They need something to help get rid of the withdrawal symptoms that they may have. And so what happens is it comes down and it pings, and then because what happens when they give you methadone, they sit in this receptor site. And you can take heroin and it'll come down and just bounce right off. It won't get the signal through. And so what? They feel better a little bit. They still feel a little bit of pleasure and reward, but they don't get that euphoric high feeling. Okay? All right, now, this is a brain scan. It's a normal brain scan here, and this is a meth abuser. So what happens when you get too much of the drug, those receptor sites close down, or you have a bunch of receptor sites there. They quit growing receptor sites, so the receptor sites go away. So what happens? They have to do more of the drug to get the same high, right? And then what happens? They go into drug rehab, they come out, they're cleaned up a little bit, and they do that same amount, or a little bit more, and what happens to them? They OD. They overdose. Okay? That's called what? Tolerance. So you build up a little bit of tolerance to it because the receptor sites don't express themselves, so you don't grow as many. Because look at, you could have a bunch of these receptor sites right here. Okay, you have a bunch of receptor sites there. Okay? So I said foods that impact dopamine, we talked about those. So you want to increase those foods. So you must have them in your diet for that pathway to work. If you want to try to fix it naturally, in conjunction with else. Now serotonin. You know anybody that got any anger, mood swings, right? Sleep? Because serotonin goes down and makes melatonin. And 90% of the 5-HTP is made in your gut. So if you don't have a healthy gut, you can't make 5-HTP to get in your brain to make serotonin. Okay? So I'm going to draw out a little bit how the serotonin pathway works. I'll make it real quick this time because you already know it. It's pretty simple. So with serotonin, it's the same thing. You're going to eat food, and the food's going to break down into tryptophan. Okay? And what happens is that's got to get on the bus again. The same thing, same bus. It's a large neutral amino acid transporter. And again, isoleucine, leucine, so we'll just say iso and leucine and val are on the bus. And then insulin has to come along and say, hey, you need to get off the bus so tryptophan can get on it. So they tell them to go to the tissues again. And then what happens, tryptophan gets on the bus, and then it goes up into your brain. Now, you have tryptophan up here. And remember, every biochemical step needs a nutrient or cofactor. This is called tryptophan hydroxylase. That's the enzyme that converts tryptophan into 5-HTP. Okay? 5-HTP. And then that goes into serotonin. So, for this step, you need iron again. So has anybody had iron deficiency anemia before? How did you feel? Probably not very good, because you weren't producing any dopamine or serotonin, so you felt like crap, and then you didn't have enough oxygen in there to transport to your brain, so you had no oxygen, so you probably felt like a slug and didn't want to do anything. So you have to check the iron levels. There's several types of iron. You can check the serum iron, and you also have something transparent, that transports the iron, and then you have something called ferritin. That's how much iron you have in your tissues. So just because your serum iron is normal, the amount of iron in your tissues may be less. Okay? And that can be a problem. Now, this next step over here, this one needs B3, B6, B9, B12, and magnesium for this step to occur. And if you don't have all of these, you will not make serotonin in your body and in your brain, and you will not feel any better. Okay? So where do we get those deficiencies from? Obviously, most drug addicts are what? They're not eating well, right? So they're not getting the nutrients that they need. So we use supplementation to increase these in their body. And we can test for these. Oh, what a concept. Let's test and see what their levels are. If they're low, we can help bring them back up and make the chemistry work a little bit better. Okay? Serotonin production can be decreased too if you have blood sugar problems because you can't transport it. Now we all know tryptophan comes from turkey, right? You ever eat a big turkey dinner, what do you get? You get sleepy. Because your insulin levels are fluctuating and you get too much tryptophan up in your brain and you go, oh man, I better go sit on the couch and take a rest. Now that's different when I talked about diabetes earlier this morning, right? That's a different mechanism there. Alright? Now, these are called methyl donors. What's that big word mean? Well, you need these things for methylation to occur. And what can affect those? Hypothyroidism. If you have hypochlorhydria, that means you don't have enough acid in your stomach and you have acid reflux. And most of you are taking the what? You're taking the antacid. Research shows that the antacids you're taking, omeprazole, the drug you're taking, pantoprazole, this study came out about 8-9 weeks ago. Those are pushing you down the road to Alzheimer's quicker. Okay? So let's talk about how we break down food and why does people have reflux. Because in medicine, they're going to give you an antacid. Why is that? Because if we understand the physiology and chemistry of the stomach, here's the deal. When you don't have enough acid in your stomach, when you eat food, it gets in your stomach and it sits in there and rots. And if it's protein, it's going to putrefy. If it's sugar, it's going to ferment. And when you don't have enough acid, that stuff starts to rot and it keeps the door open up here. You got a door here and a door here at the bottom of your stomach. This is your esophageal sphincter, this is your pyloric sphincter. And what happens is this, is that they put you on an antacid to neutralize all that medicine, right? And when you get the acid reflux, it can lead to GERD disease or Barrett's esophagitis, which can cause cancer. I understand that. But it can be fixed. Because what do I give people? I give them acid. Now I know we're talking to a bunch of drug people in here, but not the kind of acid you're thinking, okay? I give them HCl, it's hydrochloric acid. It's usually found in beets. And when you take that, you break down the food, because what happens when you don't have enough acid, this bottom door don't open to let the food into your stomach. So when you take hydrochloric acid in a supplement form, which basically comes from crushed beets, it's got enough acid, you break the food down, the door opens, this door closed, there goes your acid reflux. Very simple. So we do the opposite of what medicine does. You go tell a doctor someone's going to put you on acid to help your anti-acid, they're like, well, how's that going to work? Go read the chemistry and physiology. It's very well taken. Okay? So you have to watch, because if you have methyl donor defects, you don't make these things here. And magnesium. How many people are on a diuretic? Furosemide, hydrochlorothiazide. They pee out all your magnesium along with your potassium. And if you don't have enough magnesium, you can't make serotonin. So that's an issue. These are the foods for serotonin. You got beef, chicken, you got lamb, salmon, scallops, shrimp, okay? Some of you might not like some of those things, but you want to try to get this much food, more of this food in your system to help your body produce more serotonin. Pretty common sense when you look at it. Okay? Loss of interest in hobbies, right? You used to like to do things, feeling depressed, you don't enjoy life, you lost some artistic appreciation, feeling overwhelmed with ideas to manage. You got a lot of things going on. Increased anger and aggression is OCD, IBS, could get migraines, all kinds of symptoms that go along with, conditions that go along with low serotonin. And even anxiety and bipolar. And these are some of the drugs, I'm not going to go through them, but these are the ones that block serotonin in that little cleft, that synaptic cleft. Okay? They're called selective serotonin reuptake inhibitors, because they're blocking that recycling mechanism at the receptor site. So you make it, goes over here, pings into here, that's receptor, sends a signal in, and then this one right here gets blocked. See, it reuptakes it to recycle it. And then they block it off to keep more in this area. That's how drugs, the mechanism of drug. Now by law, I'm a chiropractor, I don't regulate drugs. I'm not going to take you off your drugs, I'm not telling you you're going to go off your drugs. I'm going to work with your doctors. Okay? So let's make that perfectly clear. Don't go home because you heard me speak today and do something foolish. Always check with your prescribing physician if you're going to regulate your medications in any way. I don't care what it is. Blood sugar meds, blood pressure meds, I don't care. Talk to your doctor. It's very important. They need to know what you're on. And then GABA, this is the only neurotransmitter that calms us down. So we call it an inhibitor. And so when you're all ramped up, what do? You get anxiety, you get depression, you get insomnia, you can't turn the brain off at night, right? Some of you go to bed, what happens? Oh, I'm so tired. You're getting bread, what happens? The brain starts going and going and going and going, and when you can't shut it off and you can't get to sleep, that could be an issue with that. And obviously, it helps with relaxation. It's anti-anxiety and anti-convulsive. Okay? Now, GABA is produced in a lot of areas in your brain, and it's done through something called the citric acid cycle, and that's where we make our energy. And so if you have a blood sugar problem, that's going to affect the way that you actually make GABA. Okay? These are some of the foods here. You got beans, you got pinto beans, lentil beans, you got all kinds of different beans that can increase your GABA. Cheese, halibut, oats, nuts, walnuts, hazelnuts, almonds, rice, and spinach. So if you're anxious, why not eat some of this stuff a little bit more often? That can help you produce more GABA. Now some people can have an autoimmune disease because you make glutamic acid and it goes into GABA and it requires an enzyme called GAD, glutamic acid decarboxylase. And what happens is that if your immune system is making antibodies and it eats up all your GAD, you can't convert glutamic acid into what? GABA. Anybody go to a Chinese restaurant and they eat Chinese food and they feel all whacked out because they eat MSG, that's monosodium glutamate. And the glutamate and glutamic acid is neurotoxic to your brain, and it causes an excitatory response. And when it causes an excitatory response, you're going to get more anxious. So I was asking people, if you eat Chinese food, does it affect you? If they do, then I might run a blood test to see if that GAD enzyme has been, what? Autoimmune, where the antibodies are attacking it, you don't have enough to turn into glutamate. Okay? Feeling of panic or anxiousness for no reasons, feeling of dread, you got the inner tension, you got all this trembling sensation or knots in your stomach, and then you're worrying about everything. You have someone come in and say, my wife's a worrywart. Yeah, we know what's going on. That's why she's worrying. Okay? Feeling overwhelmed, guilt about decisions, can't turn your mind off, disorganized attention. And there's what I already said, anxiety, depression, and insomnia. Now you got the benzos and the non-benzos, okay? These are a drug they use for people with anxiety, and people can get hooked on these benzos. Okay? So, obviously they're needed at times, but how are we going to wean them off the medication? Well, let's increase their chemistry, let's make the chemistry better. How do we do that? We check out the whole system. We check out their gut. If they got inflammation in their gut, they might not produce 5-HTP. So if you don't produce 5-HTP, you can't make serotonin. We do blood tests. We also do saliva tests to check your cortisol levels out. We also check you for food sensitivities, because research shows that you can have an allergy. That's when you eat a food and your lips might swell up, your tongue might swell up, whatever. You get a rash, you know it's an allergy. But a sensitivity is when you eat a food and it causes inflammation in your gut and in your brain, and it lasts for 6 months if you eat it one time. And that can affect your brain health, because we know that inflammation will affect the way the brain actually heals. And what kind of drugs are these people going to see? The Valium, the benzos, and the alcohol to make them feel better. Okay? And there's the food for the GABA. Now Dr. Hardy's going to talk a little bit about functional neurology.
Alright, so in functional neurology what we're doing is we're looking at the different pathways in the brain. And the way it kind of started as a subset in the professions was that a lot of alternative practitioners started to notice other changes besides just pain. So whether it's aromatherapy, chiropractic, acupuncture, exercise, all of that is stimulating a different part of the brain. Now obviously neuroscience has kind of advanced in the past, well, decades, and continues to just explode. So what we're doing is we're basing everything off of what we actually know with the neurology in the system. Once again, so we can target different areas of the brain to make a change and to hopefully get people so they're not craving and not going down the road to addiction. Okay? So just like the pathways in the brain, okay, any pathway, if you take it more often, it becomes ingrained even more. So a drug user will start to use that drug, start to stimulate a different pathway, and then that pathway now becomes a highway. Okay? What we're trying to do is we're trying to fire up the pathways that aren't being used in the brain and get those functioning better to get people away from the route they've gone. Okay? So this is neuroplasticity, the brain's ability to change and adapt. Okay? And this has only been around for about 10, 20 years in mainstream healthcare. Before that, it was thought that the brain was hardwired and whatever you got genetically was what you got. Okay? And once you develop, it's over. Well, we now know that that is absolutely false, and your brain can adapt, and we've seen it in 60, 70, 80-year-olds, even with hardcore pathologies. Okay? So let's actually look at what the drugs are doing to people and their physiology and their state. Okay? So some people will be on uppers, some will be on downers. Okay? Some, all of a sudden, they start to feel better in a different situation. There's all sorts of reasons why people might use. Okay? And you can see it in their physiology. Okay? What state they're in. Okay? So what's occurring with addicts is that you're in an undesirable state. Okay? There's something in your physiology, in your neurology, that's not working, and you're wanting to go to a different state and change how you feel. So what we're trying to do is get you closer to that state without having to use. Okay? So if we're to look at emotionally soothing, this goes into a lot of the areas that Dr. Ungar had talked about. So the fuel is going to be serotonin. Okay, the drugs that people are going to be looking for is going to be your alcohol, your marijuana, your antidepressants, your sugars. Okay? The region of the brain we're looking at most heavily to make a change to is going to be your pontine area in the brainstem. Okay? If we're to look at it from a brainwave activity, we're looking at the alpha, theta brainwave. where they want